Let's review the different types of schizophrenia, and there are 5 basic types: schizophrenia paranoid type, disorganized type, catatonic type, residual type, and undifferentiated. A 24-year-old man is brought to the emergency department by his parents after they found him covering the windows with aluminum foil because they were after his ideas. When asked who they are, he looks at the sky and points to a faraway planet. The theme of this case is one of persecution. Someone is after him, someone wants to take away his ideas, and that, of course, would be the schizophrenia paranoid type. These are the patients who basically have either hallucinations or delusions involving 2 central themes. These are grandeur or persecution. These patients tend to be older, they tend to have a better prognosis, and this is the most common type of schizophrenia. A 21-year-old man is taken to the hospital by his mother because of bizarre behavior at home. He appears somewhat disheveled and is wearing many layers of clothes despite the summer season. While in the waiting room, he appears to be very childlike and frequently barks at others. He admits to auditory hallucinations but is unable to elaborate on their content. His mother reports that he has been this way for many years. This is a patient that would have schizophrenia disorganized type. Why? Patients with this type of disorder tend to be very disorganized, have very little contact with reality, have very regressed, very disinhibited, very childlike. And of course, it does occur at a younger age, so the prognosis is definitely the worst. So this is the worst type of schizophrenia to have. While working in a psychiatric unit, you notice a 43-year-old woman who's been hospitalized for many years due to mental illness. While in the ward, she remains mute and does not respond to questions. While in groups, she stares at the wall and stays in a fixed position until the group ends. You learn she was hospitalized many years ago because she believed others were reading her mind and sending her messages. The main theme of this case is a patient that you notice is staying in a fixed position. This, of course, is the psychomotor disturbances that you find in patients who have schizophrenia catatonic type. Now, these psychomotor disturbances can either be severe excitation or severe retardation. They're going to have problems with their movements, and of course, mutism is very common. These are the patients that will stay in fixed positions for hours. You can come by, move their hands, move their extremities, and they will stay again in that fixed position. This also has a very good prognosis. However, these patients can hurt themselves because of the excitation or because of the retardation. They're not eating, they suffer from dehydration, they suffer from malnutrition. A psychiatrist evaluates a 19-year-old man after the man complains to his friends of hearing voices that ask him questions and talk to him. When asked what the voices talk to him about, he's not sure, but he knows that the voices are coming from outside his head and are not heard by others. He also presents with loose associations and frequent derailment. The theme here is that you have a patient that does not meet any specific criteria. He does have criteria for schizophrenia in that he's having hallucinations. However, the theme is not one of grandeur or persecution, so you rule out the paranoid. He's not disorganized, he's not childlike, he's not regressed, so you rule out the disorganized. He has no psychomotor disturbances, so you rule out the catatonic. And of course, he is psychotic, so you rule out the residual. So you are left with schizophrenia undifferentiated type, which is basically a schizophrenia of rule-outs. Rule out everything else, and then you're left with this disorder. And the last one. A 50-year-old homeless man is taken to the hospital after he was hit by a motor vehicle. Staff who question him note that his thoughts are illogical. He appears to have poor grooming, emotional blunting, and loose associations. What is essential in this case is that this is a patient that is not exhibiting acute psychotic symptoms. He doesn't have hallucinations. He doesn't have delusions. So basically, there's nothing as far as positive symptoms are concerned, but there's still something left of the disease. And what is typically left are the negative symptoms: the poor grooming, the social withdrawal, anhedonia, cognitive defects, and that's what you call the schizophrenia residual type. These patients tend to be older, and they of course respond to antipsychotic medications. Maybe these patients years ago were another type of schizophrenia, but right now They're not acutely psychotic as far as positive symptoms are concerned.